Hello class, my name is Abril Henry. I work at St. Peter's Hospital in Olympia, Washington. I work in an inpatient cardiac unit and do on-call in the emergency department. Working both inpatient and the ED, I kind of get to see the full spectrum of a hospital admission from the patient's first arrival to when it's time for discharge, and all the in-between, all the care coordination, all that good stuff. We also have a locked crisis unit in our ED, so I get to work with a lot of psych patients. So I feel really fortunate that I get to experience different types of patient populations, from babies to expectant mothers to adults to geriatrics. Nursing to me is like investing part of yourself in the care of each of your patients, because you do invest your time, you invest your efforts, your energy, sometimes even your emotions in trying to improve somebody else's health. My nursing philosophy is very much a product of my ethical views. I'm very big on empathy and compassion. To me, they are probably some of the most important aspects of nursing. Obviously towards our patients, but in general, being compassionate to other humans and understanding that not everyone is in our same circumstances or got to the same, had the same opportunities in life. When I worked full-time in the ED, I think that's when some of these values were the most tested, just because I worked with challenging populations. I worked with a lot of homeless and addicts and psych patients, and get yelled at and cussed out and threatened, and in those situations it was really hard to have empathy. But working in the ED did allow me to work with more of the community in Olympia, here in my city, and become more aware of the community's needs. And one of those needs is for primary care providers. So that is one of the reasons why I decided to pursue a career as a nurse practitioner. Another reason is that I feel like as a whole we emphasize more on acute treatments rather than preventative medicine, and I would like to be a part of helping shift that focus to avoid rather than lament. My personal philosophy on healthcare is that I feel like healthcare should be a fundamental right, just like we have a right to autonomy and to choose what goes into our bodies and what kind of treatments we can refuse. I feel like we should also have a right to seek improving ourselves and having access to healthcare and health education and things to help us live better lives. I think we are all aware that patients sometimes do not seek treatment or delay care because of lack of insurance or being worried about outrageous hospital bills. And as nurses and future nurse practitioners, it's part of our fundamentals that we should want patients to not be in pain, not suffer, and to be treated and have the tools that they need to be healthy, without basing it whether or not they can pay and whether or not they have health insurance. Not having access to healthcare also leads to many health disparities, primarily affecting minorities, which is something I saw when I was volunteering at the local free clinic. This is yet another reason I want to be an MP, because I feel like a lot of minority groups are underrepresented and there's a lot of misinformation there, at least in the Hispanic community, as I know. If it was up to me to change policies and laws, I would definitely start with policies to help make healthcare more accessible. I think that is one of the most important things in my point of view. Thank you everybody for watching my video. I'm looking forward to learning about everybody else.